Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Please see the indication and usage statement and important safety information at the end of this video.
Christine was referred for ocular inflammation and had early findings suggestive of birdshot chorioretinopathy. Her predominant symptom at the start was blurry vision that was a result of vitritis. My exam findings, although subtle, ancillary imaging and laboratory testing were all consistent with birdshot chorioretinopathy. I initially treated Christine with immunosuppressives and oral steroids. Once she was tapered off the initial course of oral steroids and was on immunosuppressive monotherapy, she had recurrence of her inflammation. She had a couple short courses of supplemental oral steroids, but wanted to minimize future systemic steroids because of side effects and intolerance. We discussed the option of adding a second immunosuppressant for better inflammatory control, but she was more comfortable with local therapy as opposed to multiple systemic agents. She responded very well to short-duration intravitreal corticosteroid implants and injections while maintained on immunosuppressive monotherapy. Given the absence of an IOP response and the possibility of being off all systemic immunosuppression, she was eager to proceed with long-term local therapy, so we decided to try YUTIQ. The process went very smoothly for Christine. She was given YUTIQ injections in both eyes with 1 month between each eye. After the injection, her inflammation was well controlled, and we decided to discontinue the immunosuppressive agent. Her inflammation remained under good control. She had no IOP issues, but she did eventually have cataract surgery in both eyes. She has not needed any steroid injections or any additional systemic therapy since the YUTIQ injections. She has had mild inflammation along the way, including post-cataract surgery. We've been supplementing intermittently with steroid drops which have helped. Her visual fields and electrodiagnostic testing have remained very stable throughout her course. For now, she's doing well and we've been monitoring her. We are keeping the treatment to local therapy for as long as we can. Most likely, she will get another round of YUTIQ implants once the prior ones are depleted. Eventually, depending on the level of inflammatory control and her personal preferences, we may reconsider systemic therapy. Christine has an active life and has been reluctant to go back on immunosuppression and has very much enjoyed the smooth course since YUTIQ therapy.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.